Good morning, students. Today, let's learn another short remedy, Viburnum opulus. For the final years, usually almost all the drug are short remedies. But the thing you have to do is that you should compare these remedies with similar symptoms of other remedies. So today, let's learn about Viburnum opulus. These are the berries of the Viburnum opulus. And Viburnum opulus, its common name is craneberry. It belongs to the family Caprifoliaceae, and the prover is H.C. Allen. H.C. Allen is the author of our keynote, Allen's keynote of Materia Medica. And the details of this Viburnum opulus is seen in the book of New Remedies, that is by Hales. And this Viburnum opulus is a native of Great Britain. And regarding the berries, which are sour and is used mainly for jelly, but for us in homeopathy, it is an important remedy for female complaints, especially for dysmenorrhea. So about female symptom, this is very important. Female symptoms of Viburnum opulus. You can expect for your exams or for Viva. So study well the female symptoms of Viburnum opulus and should also know how to compare with the dysmenorrhea of other remedies. So in this remedy, Viburnum opulus, it has an important action upon female genital organs, especially uterus and ovaries. And the side affinity is left. And a great general remedy for cramps. And also very much conscious about the internal sexual organs. Again, you have studied these symptoms in other remedies. And next symptom is spasmodic and congestive affections dependent upon ovarian or uterine origin with colicky pains in pelvic organ. So it is Viburnum opulus is mainly for female disease of female system, female organs, especially left-sided affection is there. And there is very much cramps. Also there is conscious sensation of the female genital organ, and also for spasmodic and congestive affections of ovarian or uterus. Then female symptoms continuing regarding menses, which is very late, scanty, lasting few hours, offensive, with crampy pains. Cramp extend down thighs. So you have studied many remedies having late menses. 2 late menses, like in Viburnum opulus, in pulsatilla also late menses, and in case of pulsatilla it is very much scanty, again pain with chilliness and flow more on daytime. Again late menses is seen in graphitis. In graphitis the menses is scanty, pale, late, but there is violent colic, and also menses get delayed from getting feet wet, similar to pulsatilla. Whereas in case of euphrasia also the menses is late, but 2 types of menses are seen. There is, if it is regular, it lasts for 1 hour. If it is late, scanty, short, and lasts 1 day. So here also, that is in Viburnum opulus, the menses is late, scanty, lasting a few hours, offensive, with crampy pains. In case of lachesis also, menses is scanty, but always in regular time, and also left-sided nature is marked. But there, the pains are better during flow. The Macphos, Zingam, etc. Then next symptom, there is bearing down pains. Again, the symptom of prolapse. You are studying more drugs like Sepia, Halonis, Murex, Natromur, Belladonna, etc. Then here the ovarian region feels heavy and congested. Again, there is pain, the peculiar nature of pain, dysmenorrhea pain. Pain from sacrum, pubis, and to the anterior muscles of thigh. And also spasmodic and membranous dysmenorrhea. It is a remedy for spasmodic and membranous type of dysmenorrhea, and there is aching pain in sacrum, pubis and to anterior muscles of the thigh. Again, you have studied the pain of sabena, that is from sacrum to pubis. While the opposite nature, that is pain from other parts of the body extending to the back, is seen in case of sepia. In case of viburnum, there is pain in sacrum, pubis to anterior portion of the thigh. That you should remember. Pain from sacrum, pubis, anterior portion of the thigh. If you learn in xanthocylum, what about the pain? It is a remedy for also dysmenorrhea, xanthocylum. Here in xanthocylum there is neuralgic dysmenorrhea. And the pain is usually in the back side, that is in the sacral region and down to the leg. That is a neuralgic type of pain is seen in case of xanthocylum. Whereas in case of viburnum opulus, the pain is in sacrum, pubis and anterior portion of the thigh. Again, there is leucorrhea, which is excoriating in nature. Again, in female symptoms, it is a remedy for frequent miscarriages, so it can even prevent miscarriage. For false labor-like pains, again for pruritus vulvae, and there is a faintness tendency whenever the patient sits up. Then pains from back to loins and womb worse on early hours. These are the symptoms of viburnum opulus, female symptoms of viburnum opulus. So, the important symptoms of viburnum opulus are its action is mainly upon left-sided nature, then crampy pain is there, important remedy for spasmodic and congestive affections. Again about menses, late, scanty, lasting for few hours, often seen as crampy pain. Barrington sensation is there, pain from sacrum to pubis to anterior part of the thigh. Remedy for spasmodic and membranous dysmenorrhea, then can prevent miscarriages. For false labor-like pains, again in colophyllum you have studied. Then pruritus vulvae, then there is faintness whenever the patient sits up, then pain from back to loins and womb, worse in morning. Then coming to the modalities, worse lying on affected side, warm room, evening, night, better in open air. Then for comparing the dysmenorrhea, pain of pulsatilla. Pulsatilla pain is very intense, restless, and the patient tosses about. And remember, all the pains of pulsatilla are attended with chilliness and worse in evening. And even there is suppression of menses whenever the patient gets feet wet. Then dysmenorrhea of Magfors. Actually, patient is better during flow, but before the flow, the patient has severe pain like spasms, aggravation, pain in back when walking, and also extend to thigh. Remember, these pains are before menses and is better when the flow begins. Then chamomilla, severe pain, and the character of pain is pain with numbness. But there is labor-like pain. Labor-like pain is seen in case of chamomilla. Then simsifuga. Other name of simsifuga is Actia racemosa. In simsifuga, the natural pain is sharp, lancinating, electric-like pains. Electric-like pains are important in case of simsifuga. Then colophyllum. Colophyllum has pain. The natural pain is IPS, that is intermittent paroxysmal spasmodic, IPS. Easy to remember. IPS natural pain in case of colophyllum. Then xanthocylum. Xanthocylum having almost similar to this of viburnum opulus, but the type of the dysmenorrhea, that is in case of xanthocylum neuralgic dysmenorrhea, whereas in case of viburnum opulus spasmodic nature is more, and congestion, spasmodic congestion like symptoms are important. Then apart from this dysmenorrhea, The conscious sensation of womb is said in case of viburnum. Conscious womb, isn't it? This conscious sensation of womb is also present in other drugs like Murex, having distinct sensation of womb. Distinct sensation of womb. Then Helonius, also remedy for prolapse, having always conscious about her womb. Lysine also. Lysine, it is a remedy for uterine prolapse. Said that many cases of years standing had cured with lysine. And also for different nature of pains, crampy pains, neuralgic pains, electric-like pains, there are different remedies. Then for prolapse, bearing down pains, for different nature by amelioration, aggravation, you have studied. Important one are sepia, wants to sit and cross the lung. Then again, Murex, again want to sit and cross the limbs and is ameliorated by pressure. But the difference between sepia and Murex is that sepia loss of desire, but in case of Murex there is desire. Then regarding Lillian Dick also there is bearing down sensation. There is a sensation as if the all organs will escape through vulva, and is better by supporting the vulva with hands. Then regarding the nature of pain from sacrum pubis anterior part, said that here viburnum opulus, then similar to sabina, then opposite in case of sepia. Then for miscarriage also there is also so many remedies depending upon the month, stages of month. Then here the nature of blood is dark nature, and also offensive nature are there. You have studied so many other remedies having dark nature of blood with offensiveness. In cases Hamamelis, bleeding is dark and profuse. Macphos also black, clotted, stringy. Crocus again stringy, dark, black, stringy. Helonius, clotted, dark clotted. Lillian Tig, dark offensive nature. Maccarb, Macmore, all these are black and clotted. Again Lachesis, creosote, all are dark clotted. Then the opposite nature, that is bright red blood is seen in case of lacananum, phosphorus, etc. So these all are about viburnum opulus. So study well the female symptoms of viburnum opulus, that can be asked for your exams. Thank you.